My name's Emily. I'm a new department member in this exercise science and sports studies department. So we're going to go ahead and get started. As I was saying, the purpose of the class is really to give students a chance to figure out what it is or what type of careers they may want to pursue for their future careers. So thank you all for being here. And I'm going to get started first. If you could all just maybe go through and introduce yourselves, provide what you're currently doing in your careers, and that would be great. So just kind of a general introduction.
I'm going to start. I can start. Can you hear me? Good. Okay. My name is Amber Seitzinger. I graduated from St. Ben's in 2011, and I am an occupational therapist. I went to the University of Minnesota for grad school, and so it's been about 8 years or so that I've been in OT, and I'm also the therapy manager at the hospital that I work at right now as well. So I do part-time treatment, part-time management. I work down at Avera Holy Family Hospital in Estherville, Iowa. I've been there for about a year and a half now. And so we do outpatient therapy is mainly what we do. And then we see inpatient, it's a small hospital. So we do some inpatients as well, and then some home health. And so what occupational therapy does, if you guys aren't really aware, but similar to physical therapy, but different in the fact that we do mostly upper body rehab after like orthopedic injury, like a shoulder injury or elbow, wrist, digit. So all that sort of rehab. And then we look at just activities of daily living, like dressing, bathing, toileting, any activity that someone would want to do throughout their day, and kind of help them rehab back to doing that, or teaching them compensatory skills or adaptive strategies on how to do that. We work a lot after someone maybe has a joint replacement on how to do things differently while they have certain precautions. And then a big thing is just going into the homes and doing more functional tasks with them as well. So it's very kind of a broad profession, which what drove me to the profession in the first place. So I can answer more questions about exactly what we do, but that's where I'm at, and I'm happy to answer any questions you have.
Okay, I guess I will go next. My name is Callie Kohler. I am a chiropractor here in the cities. I graduated from St. Ben's in 2010. Went to Northwestern Health Sciences University immediately following, graduated from there. And then I actually went on to get my certification as a certified chiropractic sports physician from the American Chiropractic Board of Sports Physicians out in Colorado through the USOC, the United States Olympic Committee. I was in practice as an associate for almost 5 years. And then almost 4 years ago, I actually purchased my own practice. And so I'm in private practice. I treat a wide range of individuals, but we do incorporate a lot of muscle work, physical therapy into our office, rehabilitation, dry needling, different physiotherapies, massage therapy. So we really try to be like a holistic one-stop shop for kind of your neuromusculoskeletal needs. So any questions with that, the business end of it, happy to help.
I guess I can go next. My name is Terence Ellis. I'm a 2016 graduate, St. John's. Recently in 2019, I just got done with my master's program in clinical exercise physiology. So there's a lot of different things within the field. It's really broad, I would say. I focus a lot, and my focus is in actually cardiology. So I work out in like a cardiac stress testing lab is my primary role. So I do a lot of just studies for ordered by either cardiologists or other primary care physicians or specialties. I also do a little bit with outpatient cardiac rehab as well. So I kind of provide support in our outpatient clinic there as well, doing mostly like exercise therapy, behavioral change, a lot of different education pieces with that as well. So I get a lot of different variety within my work week, I would say, as well as my location. So I primarily work out of the Wyoming clinic, which is just north of Forest Lake. But I also provide some support down in Edina, Maplewood. So I get a lot of variety just moving to the different clinics, getting to work with a lot of different staff. So it makes for an interesting work week. Keeps me on my toes a lot. So something that I've really enjoyed. I've been doing it for about 3 years now. So again, any questions or interest in this area, hit me up.
All right, I think I'm the last one to go. So I am Erin Lynch. I graduated in 2017 from St. Ben's, and I'm currently a PhD student here at Mayo Clinic, and I'm in a virology and gene therapy track. So a little bit off health science track, but my thesis is looking at using viral engineering to do gene therapy in joint microenvironments. So a little bit of a different approach, but if you have any questions about PhDs or using virology and gene therapy, I am happy to answer any questions.
Awesome. Thank you all for sharing. I'm going to just start out pretty broad here with just thinking back to your CSB SJU experience. How did you all decide what it is that you wanted to do? And if you could give the kids some insight in terms of when you figured this out as something that you wanted to pursue as a professional career. So.
Yeah, I can go first. I actually started at CSB as a nursing major. I was pre-accepted into the nursing program. I thought 100% that's what I wanted to do. And then I realized as a nurse, I had to give people shots and I was done. Like, nope, I'm not going anybody else. So then I kind of just explored some other options, talked to some people, and I actually wanted to go into physical therapy. And so then I started shadowing physical therapy. And I was actually at, I think, Spot Rehab. I don't know if that's still open, but I think it was in St. Cloud at the time. And they had me shadow some occupational therapy while I was there as well. And just from talking to the occupational therapist, I switched gears. And like I said, it's more broad. We can treat a lot of different type diagnoses, and I think have a little more fun and be more creative. And that's kind of up my alley. So I made the switch to OT. But I guess the advice, so I probably was a sophomore in college when I made that decision. So I don't have it figured out yet. Like, it's definitely not the end of the world. But I would say job shadow, really understand what you're getting into. If you're on the fence about anything, in the medical field, just call and ask if you can job shadow and actually go see and kind of live it for a while. And that's my suggestion. But
Yeah, I would agree with Amber. Just shadow, talk to people, reach out. People are really more than willing to help. In regards to my personal experience, I actually entered St. Ben's as pre-med, pre-PA. I was going to go kind of more of that route. And actually organic chemistry, I developed migraines, and so debilitating migraines. Went to my doctor. The only relief she offered me was actually to take an antidepressant. And I knew I didn't want to mess with my neurotransmitters, and like that wasn't the route I wanted to go. So for the first time ever, I went to a chiropractor, had great success, learn more what that field was about. And to be honest, I applied to PA school and chiropractic school and literally did not make my decision till April of my senior year. So I was lucky that, anytime you're kind of pre-med, pre-whatever, a lot of the qualifications overlap, but it's never too late. My roommate actually made the decision July after she graduated senior year to go into chiropractic school versus going to pharmacy school. So never too late, but just reach out, talk to people. I know the St. Ben St. John's network is great at connecting you with alumni who are in your profession. So reach out to them, and everyone is always more than happy to help.
I think just kind of echoing what everybody else said, my philosophy has always kind of been, sometimes it's just as helpful to know what you don't want to do as it can be to know what you want to do. I started off as a nutrition dietetics major, took a lot of different like exercise science, sports studies classes at St. John, St. Ben's. And, I was like a sports medicine assistant for the St. John's rugby team for 3 years. I really liked that. Kind of thought I'd want to be an athletic trainer. Long story short, ended up not going that route. Worked in like a weight loss clinic for about 2 years and then decided to go back to grad school. So I think just, getting your feet wet, talking to as many people as you can, networking can be helpful. And again, there's no pressure to necessarily make a decision as a sophomore or freshman. I mean, I've had friends, that, it's senior year and they're still kind of trying to sort things through. So I think, just doing as much as you can. St. John, St. Ben's has a lot of opportunities to explore different avenues. So just take advantage of that and you'll figure it out.
Yeah, I think I'll continue on with saying the same thing. Is going out and getting experiences is really great. The area that I'm studying in viral therapy is kind of an emerging field, so there wasn't a lot of like background in it. I took a class through Mayo Clinic kind of on an off chance while working there and found this field. So I think a lot of it is just being okay, trying new things and like taking like a chance sometimes to explore different areas, since you never know exactly where the niche is unless you try. So trying the new things and taking the classes.
Awesome, thank you. I'm going to open it up. Do students have any questions so far? All right. All right, we have no questions, but I have lots of them, so we'll keep going here. Maybe thinking back to, your experiences at CSB-SJU, what type of experiences were most helpful to you in terms of your now careers? So maybe start with that and then reflect on what ones were maybe not so helpful, or maybe things you wish you would have done.
I'll jump in. One of my favorite experiences actually was study abroad, which has and I did the Greco-Roman program. So as you know, it's like art history and it has nothing to do with science. And to this day, it is one of my favorite experiences, but B, you met different people, you had these different experiences, and you learn how to communicate with people in a conversation and manner other than people in your own field. And what you'll know is if you get into any program or any career working with individuals who are different than you or think differently than you, it's great to have like experiences of common background to kind of come and make that connection with them and then establish that rapport, build confidence, and move forward. So just the skill set of communication and speaking with people and learning how to communicate is just an invaluable skill that I think St. Ben's St. John's does a really good job at broadening your horizons and making you step outside your comfort zone a little bit.
I would agree with that. I did not study abroad, however, but and again, kind of an off topic, but when I was in school at St. Ben's, I was on the volleyball team. And not everyone I know has the opportunity to play sports, but if you could get involved in something, even like intramurals or club sports, I mean, that just time management for one, getting to meet new people, challenging yourself. I mean, just take advantage of all the opportunities that St. Ben's St. John's has. I think one thing, if I were to go back, I would try and get involved more with some of the clubs. Like I think now they have like pre-PT, pre-OT, stuff like that. Not necessarily, I think that was kind of all emerging when I was there, and I wasn't a part of that, but I think just getting to know, like I said, like-minded people that want to go into that profession as well. Once you get out into the working world and you have your career, you kind of realize how small the world is and everyone knows everyone. So just having those connections is very, very helpful.
Yeah, I would say, for me, probably what was helpful, I don't think it's like one necessarily thing that I could pinpoint, but just some of the classes I think that I took overall that weren't really necessarily my major, but sounded kind of interesting. I think I learned a lot more than I thought I would, just kind of in general terms speaking here. And then one thing that I didn't do that I kind of wish I would have, that I thought would have maybe been helpful, was even like a short-term study abroad. I didn't study abroad or do a short term, but I was kind of on the fence about it. And I know a lot of people that ended up doing that really enjoyed it and really learned a lot from it. So I think some of that stuff can be really invaluable, and, just kind of pave the way for, critical life skills that you never thought you could even develop on something like that. So.
Yeah, I would have to say some of the labs. I mean, I'm in a lab environment, so the labs I thought were very, very important. Chemistry lab, even though it is the 4 hours and you want to get out of there, like take the opportunity to learn the techniques and everything. I thought the exercise science department did a really fantastic job of making labs where you had to design experiments and think critically about things. So in particular, the ESS labs were a big, big help, actually. Even if I would like transitioned over to virology, it was still helpful to have that sort of skill set. So the labs are actually quite helpful. And then I did study abroad as well, and that is helpful in terms of like learning how to speak to people who are not in your field. about like your interests in things. Not everyone's going to be excited about the same things, but knowing how to convey what you're doing in a way that is understandable for all people is also very, very important. So
I just thought of another one as I'm sitting here listening to everyone. But so as a manager, I'm actually going back to school right now to get my master's in healthcare administration. But just as like an entry level, anyone in the medical field, I think that something I wish I would have done in undergrad and just being getting my bachelor's of arts degree and stuff, I wish I would have taken more marketing communication type classes as well. And I just think that would benefit just from being in a profession where you're constantly interacting with people. So if you have the opportunity to take a few of those classes, I would recommend that as well.
Thank you. And kind of piggybacking off of that, so we talk a lot about really the science and building that foundational knowledge in this course. But I think something that you all have kind of mentioned is that communication piece, or being able to work with others. Could you speak to the importance of that or not in your current applied fields, and how you have gone about maybe developing that yourselves as an individual?
Absolutely. And you guys will learn this too. When you're learning all these new medical terminology and you're in school and you're immersed with it, it's hard to make that your normal speaking. And by the time you come out of whatever program, you're speaking in a physiological, anatomical manner. Now you have to go back and try to talk to patients. And instead of saying, oh, your PSIS, you're going to say, oh yeah, your SI joint. Now you have to convey that anatomical knowledge into a language what they will understand. So I think it reaches back to just meeting the patient where they're at, not overloading them with your medical terminology and kind of, I hate to say dumbing it down, but talking to them at the level they're at. And back to the communication piece, everybody's going to be on any part of the spectrum. So you have to just really meet people where you're at. I think St. Ben, St. John's does an excellent job of putting you there and able to talk to a wide range of people from all sorts of areas across the spectrum.
Yeah, I would say for me, especially if you're going to be in any sort of patient care, you have to be a people person. You have to be able to feel comfortable talking to other people. And like I said, in therapy, you're seeing 8 to 10 people probably a day. And so being able to empathize with them, hear them out, and then like Callie said, just being able to explain something in a way that they understand it, because you are the expert in your field, and somebody walking in isn't going to necessarily obviously have all the information that you do. But just continuing, like it's taking opportunities in college to be able to meet people, be social. So you really have to have those people skills in order to be successful.
Yeah, I think for me, a lot of it's like critical thinking too, where I see a lot of patients, like an example, I do like a lot of cardiac stress testing. So they might have a test every year, every couple of years. So kind of reading the room, knowing their backstory too can be helpful with, I'm not going to go through my, in-depth spiel necessarily with somebody that's had 3 tests in their life. They probably know what they're doing. But, if it's a first-time patient that's, has a lot more questions and concerns, and you can see that they're a little bit more nervous, then you might take more time, meet them where they're at, walk them through the process a little bit more slowly. So I think being really effective communicators is really important, just with making the patient feel really comfortable, or what, just in the field of exercise science in general. A lot of jargon gets thrown around, but then also I think too, it's kind of like a light switch where, you got to simplify the information that you're giving them, but then when you're going back to report to whether it's your coworkers, a doctor, whoever it is, then it's kind of, you're using more of that medical terminology again. So kind of balancing that back and forth is important.
I feel like my perspective might be a lot different since I'm in a lab kind of away from the general world. You normally don't think of a scientist as being outgoing and like talking to lots of people, but I think at least in virology, this last year has been a huge learning experience for how important communication is, even if you don't normally work with a ton of people, and how to educate public like the public on viruses and whatnot has been definitely illuminated this past year, and how communication and speaking in terms that everyone understands is extraordinarily important. So especially with the treatments that are coming out, where we want to treat your cancer with a virus, people don't always understand exactly how that works and whatnot. So having that basis of communication is becoming more and more important in the scientist world, at least.
Yeah, I will go.
Just, I mean, we talked a lot about like how you communicate with patients and stuff, but just knowing that in this field, it's very interdisciplinary. And so you're going to have to feel comfortable talking to other professionals, doctors, physical therapists, nurses, lab. I mean, you're going to have to feel comfortable talking to them too, to really figure out what's best for all the patients. So just another aspect of communication that you don't always think about.
Great, thank you. I'm thinking too, maybe if all of us or all of you could give us kind of a breakdown in terms of like a day in the life. So what's your typical day look like in your field? Maybe we'll generate some questions from students with this one. So.
Yeah, so my typical day is not what I'm experiencing right now, but I'm feeling an orange. So we have an outpatient clinic that's based out of a small hospital, like I said. So for me as a manager, like I said, I treat about half time. But as a full-time OT, I'd probably see again like 8 to 10 patients a day, probably 5 or 6 outpatients that are coming up and into the clinic. In between those patients, I may run down to the hospital to see 1 or 2 people down there. Again, we also do home health. So that could be in the middle or the end of the day where I'm driving to someone's home, treating them there, driving back. So I work at a very small critical access hospital. So we kind of have all of those settings that we work in. But generally the clinic's open from 8 to 4:30. We don't typically work on the weekends unless we have someone in the hospital that needs to be seen. But again, at a bigger or larger hospital, you're not going to find that you're going to do all those different settings. You may just do acute care or work at a straight outpatient clinic. But that is one thing that I do like about my setting as well, is that you kind of have those other options, or you kind of, I guess you keep up on your toes and you're doing a bunch of different things. So that's what my days look like.
Yeah, my days are never, ever the same, and the schedule does not reflect what kind of day you're going to have. So things can always change on an instant. I'm unique in that I spend about 15 to 20 minutes with each of my chiropractic patients based on style, philosophy, things like that. So every chiropractor is kind of different in that regard. But I work 5 days a week. Like I said, I treat anyone from infant newborn babies to my current patient is my oldest patient is 105 years old right now, and kind of anyone in between. I do work a lot with the athletes here in town, both from the youth level to the high school. I've actually worked with a couple semi-pro and pro athletes as well with my sports medicine diplomate. Like I said, I have training through the USOC, so we get to see a lot of unique patients through them. And it makes us actually qualified with my diplomate to be able to work and go over to like world events, Olympics, things like that as well. So we got some inter-referrals from different docs in that regard. But I incorporate a lot of muscle work into my care, some physiotherapy, but my day is also just not spent treating patients. You know, I might be referrals to neurologists, on the phone with orthopedic surgeons. And then I do own the business. So I'm sending payroll and paying bills and dealing with the internet company, you know, so if any of those things, those have to get shoved into the day as well. So, and if anyone's acute, you know, people can't always wait, you know, a week to get in if their back goes out. So then I treat emergency cases too. I do see people on the weekends on an emergency basis, but I'd say that only happens about a dozen times a year. So not necessarily that often, but when you're the sole primary provider, I mean, if you start the day at 8, I sometimes start the day at 7 if people need to get in. So you got to be able to be flexible. And that is one of the things where I do love about this job is it's pretty almost instant gratification. But like Amber said, you're wearing many hats. You don't know who you're talking to, and your day is never the same, which is one of the main things I love about it.
For me, the clinic that I operate out of, we're 7:30 to 4. It's outpatient. So my typical day usually starts off. So we usually set our schedule set up where we do like 3 stress tests in the morning. So those are called stress echoes or stress echocardiograms. So I'm hooking patients up to a 12-lead EKG monitor. I'm running like the EKG cart. And then we have them walk on a treadmill, basically till they get to a heart rate or they have symptoms. And so with that, with the stress echo, it's paired with an echocardiogram as well. So we have an echo tech in the room so before and after they walk on the treadmill, they do like an ultrasound of their heart. And then sorry, go ahead.
You're good. I think I got
okay. So that's how my morning's kind of set up. Otherwise, we do a lot of chart prep ahead of time just to make sure there's no like contraindications to stressing the patient. There's kind of a long list of why we wouldn't do a test. A lot of orders that we do get are from cardiologists, so they typically obviously know what they're doing, but sometimes we get outside orders from other specialty clinics or primary care doctors where sometimes there's other tests that would be better suited for the patient. So we usually do a lot of navigating with that, communicating with them just to make sure we give the patient the best care, best test that would be most appropriate for them. Then my afternoons usually set up where I'll just do some other standard stress tests, usually like 2 of them. Typically those don't have imaging with them, so they're just a normal stress test with an EKG, but no imaging component. The days that I support cardiac rehab, that can really vary as far as what I do. Sometimes I'll do like evals or consults where we're introducing patients to our program. That's typically about 8 to 10 weeks. There again, they're hooked up to a monitor. It's not quite as in depth. It's like a 1 or 2 lead usually. So we can still see like their heart rate and rhythm. And then a lot of like behavior modifications. We do a lot of education classes. And then, we update like paperwork, check in with patients individually, see how they're doing. So that can really vary too, as far as what that day looks like and just kind of depending on the staffing that we have that day. But that's typically kind of how it works. I guess if I work in the Edina clinic, then I'm typically doing like 6 stress tests back to back to back. So they're a little bit busier. So a lot of variety.
Yeah, so I have a very, very large amount of variety in the day, simply depending on whether or not I've got class or you've got seminars or literature reviews with the departments. Some days can include animal model surgeries. So you could be doing surgery for 4 hours to 5 hours a day. You can be running benchtop experiments. If you think to your chemistry classes, your oxidative reductive reactions or whatnot. So you could be doing chemistry one day and then surgery in the afternoon, or going to class in the morning. As a grad student, not to scare anyone away from biomedical sciences, but sometimes the days can go much, much longer than you expect because an experiment didn't run the same way you thought. There are often times when you have to come in on the weekends to continue experiments because they've got time points or whatnot. But I feel like a lot of that is kind of an expectation with a PhD degree. So sometimes a little bit, a lot to look at, but a lot of variety in your day, a lot that you can kind of follow your interests in, since you are your own leader by way of what your thesis is. So I really enjoy looking at joints and whatnot. So after you do surgery to see how things are regrowing, you can do tissue staining, but you can also do your chemical reactions to see what you're putting in. So there's just a lot of variety in even the way you're thinking about things, since at least for me, the way I think about going into a day where you're doing animal model surgeries is a lot different from going to the wet lab and purifying a virus or something. So yeah, every day is different.
Awesome. I'm going to pause and see if anyone in the audience has any questions now that we've went through their days. Any specific questions for anyone? Oh, okay. Yep.
I just have a question for Callie, like how long is she on her own practice? Active and like active.
Yeah, so like starting a business.
Yeah.
Okay, so this one is going to be for Callie. The question is, how long did it take for you to kind of get your business going since you started your own, and what was that process like for you?
Great question. So like I said, I was an associate for 5 years prior, which some people are out of school started right off the gate. I will say, if we're talking just like, again, not to scare anyone, but like finances and everything like that, it is very hard to get a business loan when you are coming out of chiropractic school with a lot of debt, unless you don't have debt, which if you don't, fabulous, good for you. But so I was an associate for 5 years, saved up, and then I actually purchased an existing practice, which I would highlight, if it's the right fit, it worked really well for me. Getting through the legality of it, when you purchase a practice, you are able to stay in network with the insurances that the other provider was in. So like Blue Cross Blue Shield is a closed network. You can, if you graduate for school, unless you're part of a clinic, you cannot obtain to become a provider with them. So it was a very positive aspect in that front. You also got to be careful and do your research that it's a good practice, good reputation, that kind of thing. But it was a transition process after that. So I actually had the doctor I bought the practice from stay on, so we could kind of transition patients, and that worked out really well. In terms of starting up from scratch, I have a lot of friends who did that, and it is a pretty rigorous process. I mean, you have to be ready to be able to get out there and, put your name in the community, go do public speaking, health seminars, that kind of stuff, and just kind of really make you known and your services known. And once you start and you build that reputation, a good reputation is going to get you further than any marketing ploy or scheme or anything like that. People really want to trust and build a rapport with someone. And if you have a positive reputation within your community, the patients tend to come to you. So the best marketing is yourself and a good word of mouth from your own patients. So if you want to talk more about like the nitty gritty of getting stuff going and things like that, feel free to email me or call me. I'm happy to reach out more in the future. But purchasing was, for me, a very positive aspect. And if you're young going in, I would absolutely say look into it. There's a lot of docs that are getting ready to retire, and your clinic is your retirement from that standpoint. Your business is your retirement a lot of times for your chiropractors. So they're looking to sell. So if you can do an associate or intern and build that rapport and relationship, the transition will go that much more smoothly. I hope that answered your question.
Thank you. So any other questions in the room? Yeah.
Yeah, another question for Callie. I was just curious, how much time do you think you put in the day for just chart notes and bookworks? My father's a chiropractor himself, and he says like the charting notes and chiropractic and things of that nature are quite strenuous over time.
Did you hear that?
I kind of halfway.
Okay. So how much time do you put into chart notes? Nash had said that his dad is also a chiropractor, and it's a strenuous.
Did I hear you say he had chiro touch?
Yes.
Yes. Okay. Yeah, great point. No one ever talks about the paperwork that's required. Just paperwork from like writing, like I said, referrals or anything like that. But I do something a little bit different. I actually have voice dictation in my office. So I have the computer and the notes, and actually give me a hot second. It's right set up there. So as I treat the patient, I will right click and they'll say they're subjective to complaint. So I'm voice dictating while the patient's in the room. I'm also voice dictating their findings and things while I'm treating them. When I'm going through their assessment, I'm saying what they found and then their plan. I'm like, patient to ISIF sore follow up next week. The patient then heard it. I just did my note all at the same time. So for me, it actually is a time saver. It took a while to get used to doing that in front of the patient. But patients I have found have really liked it because it's a way that I'm verifying that I heard them correctly. So it's just another point. So I tend to chart while they are in the room with me, and it saves a substantial amount of time. Things that, you always have to go back and add in later on, but I would say since doing this, I hardly do notes at home anymore.
Thank you. Any other questions? All right. We'll keep it moving then. Could you all just tell us a little bit about what are the best and worst parts of your jobs? So if you had to kind of go through that.
Go ahead.
Sorry. I'll go first.
Go ahead.
I know Callie, we took some classes together. It's kind of fun to see her again. But I would just say the best part of my job is just like Callie said, kind of that instant gratification that you can get after seeing a benefit and helping someone in probably 1 sessions. That's really the reason why people get into the healthcare field. I would hope that you want to work with people and help people and make them feel better. And it's always fun just getting to know new people always coming in for therapy. So I think just the people that you work with and then the help that you're able to give them is what keeps you going. I'd say some of the harder parts about my job, I don't know, I just like really love it all. I think some of the management aspects of it are a little bit tough, being in the management field, but I also love that. I do some pediatrics, which I really love as well, but at times that can be difficult when you're having to maybe give, maybe some bad news to the patient or the parents, or it's just not always my favorite setting to be in. And then I think just sort of not necessarily a bad thing, but like Callie said, not every day is the same. Things come up. So you're not always able to leave right when you want to. And so you really have to be flexible in probably any healthcare career, which isn't necessarily bad. You just have to be aware of that before you jump in. So prior, I guess, to my setting now, we did work holidays, we did work weekends, and that is just part of healthcare. The hospitals don't shut down. So like I said, not a bad thing, but just be aware of that before you jump in. So.
Yeah, I would agree with Amber. The people, you do it because of the people, you do it because you want to help people, so that the gratification, especially people who are struggling in pain, or people who physically literally crawl in or get carried in and can walk out, and then that's not always the case. So it's frustrating when you can't always help someone, or again, like when you're delivering bad news to someone, like Amber said. For me, I'm going to piggyback, and not to be a Debbie Downer, but the worst part of my job is insurance and dealing with insurance companies. And chiropractic is a field where altogether, physical therapy, medicine, everyone, we're working so more integratively, and it's wonderful and it's great to see. But unfortunately, insurance isn't always about getting the patient better. So when you're working with those constraints as well, and sometimes you're like, I'm sorry, you have to tell the patient, like, I'm so sorry, your insurance doesn't approve any more visits. That's hard, and that the financial component comes into play. And we really try to work with people and not make that the primary motivator. But when you're dealing with insurance companies and regulations with that, that can be it's very frustrating.
Yeah, I guess what I'd say for my profession is, like in my cardiac rehab position, just seeing a lot, like what hard work can do. A lot of patients come in very low level, or if they've had bypass surgery, sometimes they're coming in a wheelchair, and seeing when they go through a program 8-10 weeks later, they're walking 2-3 miles, not short of breath, no chest pain. So that's a really cool component of it. And then I guess some of the negatives, if somebody fails a stress test, that's never fun. Usually it's an emergency visit, or they're meeting with one of the cardiologists right away. So that can be a little bit, you never know what you're going to expect or see there. So some of that can just be kind of triaging and working with a lot of different professionals just to get them that care that they need. And then I guess in my rehab setting as well, just some of that behavior change stuff can be difficult at times. So it's just kind of one of those things, you got to be really patient with patients. But yeah, I would say overall, it's like I said a couple of times here, I get a lot of variety. I get to work with a lot of different professions, and only being in the field for about 3 years now, it's been nice to get a lot of different perspectives and techniques and skills from other professionals in my field. So that's been really, really a cool piece, just a lot of variety.
For my perspective on it, I definitely say that PhD has a lot of high highs and a lot of very low lows. So as a PhD, your job is pretty much to learn. And when you do something correct and your hypothesis works, you've created something new. When we do cloning, you've created a fully new vector that has never seen the world before. So you can create new things and develop really, really cool new approaches to things that have never been done before. But your life is based on hypotheses and whether or not they run or not. So a lot of times you have to have a lot of resiliency in whether or not experiments completely fail or not, since it is new technology, it's new approaches to things. So being able to take the successes with the failures is kind of like the up and down of it. So you get to learn a lot, but a lot of the learning comes from the failures.
Awesome. Thank you. Any questions? All right, so I know a lot of you mentioned, which is something we don't always talk about so much because we tend to spend more time thinking about the applied side of these fields. So would you have any advice for students to gain more experience understanding the business side of your careers in terms of, the things you mentioned, dealing with insurance? So maybe advice like taking a class or any thoughts on that, like things you wish you would have done as an undergraduate to be better prepared for learning how to manage that? Or was it something you just kind of have to jump into and get used to?
In terms of like the insurance world, for me, it's you kind of have to jump into it and get used to it. At Northwestern, they don't even teach on insurance really, very mildly, but because it's ever changing. And in regards to the business, I think Northwestern actually does a very good job at preparing you for the business side of it. Northwestern is the only chiropractic college in the state that actually offers that makes you take a business course every single semester for 10 semesters. Because as chiropractors, more times than not, you are in private practice. In regards to St. Ben's, St. John's, I mean, they did such an amazing job with the science portion. I remember going to Northwestern and starting my anatomy phys and cadaver lab and everything and thinking, oh my gosh, this is a review, while other people were literally struggling and failing out. So, I mean, hats off to CSBSJU and that, because I felt so well prepared going in. In regards for classes that could have prepared us for the other things in life, I think if you're thinking about the science and be like, oh, I never need to take a business class or a communications class, never say never. And it will only make you more rounded as a person and be able to relate to others. And like you might be in a managerial position when you're done. Like you never know where life will take you. So I think the more tools in your toolbox, the better off as a person and more valuable asset you will be in any profession.
Yeah, I would agree with Callie. And I had mentioned kind of prior, maybe just what I would have taken as an undergrad would have been like a marketing or communication class as well. Because like Callie said, you never know where it's going to take you. And if you're going to start a business or, do something on your own, marketing is a huge aspect of that as well. I would also throw in, wouldn't be a bad idea to take like an intro to accounting course. I think that would be very beneficial, just learning what an income statement is and what things look like that way. The insurance side of it, I would tend to agree that that's kind of just to learn as you go, because that's also going to just be based on what type of contract your business or whomever has with that insurance company. So yeah, I think that, yeah, it's definitely kind of a learn as you go. But if for undergrad wise, I would say you have an opportunity like an intro to marketing or an accounting class would be beneficial.
Anything else to add, or?
I would say a writing class. When you're writing grants and papers and your thesis, all of it requires a lot of strong writing skills. And while you do get some of that with lab reports, the extensive amount of writing that you will do, it is nice to have a little bit more background in it. I got some of that with my FYS class, but I think I would have taken another writing class and just improved upon that even more, since the better you write, the more grants you get and the easier it is to continue doing your science. So.
Awesome. Okay, so I think I have one more question and then maybe we'll leave like 2 or 3 minutes for questions in the audience. But thinking about, I guess, the future of your careers, where do you all see your career field going? Maybe thinking in the next 5 to 10 years. Do you see any big changes that in the future, or just general thoughts in terms of, for those of us in the room who will be kind of joining these careers? And
in the world of chiropractic, it is exploding. I mean, I think we're getting more clinical science, more hard research to really support our field. It's only been around since the late 1800s, so it's relatively new. So we don't have a lot of physical, double-blind studies and research to back it up, and that's coming. And so as it's becoming more accepted, you're noticing more people work with other providers. Like I work directly with Twin Cities Orthopedics. I mean, I had one of the orthopedists send me a patient. He's like, take a look at this guy, get a second view. I work directly with physical therapists, neurologists, and very much inter-referring. So as life hands us more stressful situations, I think people are not always looking to pharmaceuticals and trying to look for holistic, more natural approaches. So the potential for growth is great. And I think you're going to really start to see a lot more integration of chiropractic and natural sources of medicine within communities and hospitals. I mean, you're already seeing emergency room departments employ acupuncturists full-time in the emergency room for pain management and things. So it's coming, it's growing, and we are always looking for good quality patient-oriented people to help move the profession forward in a very positive manner. So I'm very excited for working with other providers and individuals, and again, helping people at the end of the day.
I think in my field, there's a lot of, just medical device stuff, whether it's stents or just different procedures that can be done. Those are just really taking off right now. I don't know if I said this before, but so I work for M Health Fairview. We're partnered actually specifically with the University of Minnesota's nursing program. So we also work a lot with patients with PAD or peripheral artery disease. So we usually have a couple of students every semester that come to, and they do a lot of research on patients that we specifically work with, and just far as exercise modalities and most effective treatment for that specific chronic issue. So there's a lot of new research coming out on those types of things as well. So as you all know, it's always changing, always evolving. So you can't go wrong in the field.
Okay. Sorry, I got a sidekick now. I'd say the field of occupational therapy and just therapy in general, you're just going to continue to see it grow. We've seen so much growth in the last 10 years, and I think it's just going to continue. And I'll piggyback a little bit off of what Callie said, but really see kind of the medical field changing from more of a reactive, I guess, outlook lens to proactive, and looking at more wellness services, preventative services. And occupational therapy plays such a big role in that, and just patient education, more community-based services, groups that we could run through OT. But if you look on career outlook, that it's constantly growing. There's way more jobs than people are graduating. So it's definitely a good field to get into right now. But again, I just foresee it continuing to grow and also shift more. You're always going to have the rehab aspect of it, but looking more into the wellness, holistic view, preventative type treatments. And really that's what insurance is like to see right now too, because I'd rather have someone do that and stay healthy than need to go to the hospital. But yeah, so I just foresee it continuing to grow.
From my standpoint in virology, I think there's a lot of potential in the field coming up. So since virotherapy is kind of an emerging field, whether you're treating cancers with viruses, you're creating vaccines using viruses like the Johnson & Johnson, or if you're using viruses to deliver payloads in terms of gene therapies, all three aspects of it are becoming more and more popular, as we've seen with the Johnson & Johnson vaccine. Gene therapies are coming to the clinic for treating blindness, metabolic disorders and everything. So as these continue to be more successful and more widely accepted as positive treatment measures, I think it will continue to grow a lot. And there's lots of room for things like patenting. Lots and lots of hospitals are just getting into it. So if you want to do something like a medical science liaison, it's a positive thing to have a virology background, since there's a lot of jobs that are likely going to explode with the introduction of using viruses in a more common aspect. So.
Okay, thank you. We have about 3-4 minutes left, so I'll leave it to students in the room. Any final questions or thoughts? Yeah, Nick. which classes have been the most applicable to your careers now, is the question.
I mean, I guess I was a biology major, and then I minored in psychology. So again, a lot of like these pre-med and medical fields, I guess, have science background. So I would say any of the sciences, and anatomy and phys probably is the one that I use the most often. So
Yep, I would say the same thing. Anatomy and phys, like I said earlier, I came extremely prepared. It was a review in graduate school for me. Microbiology, just because I do a lot in terms of like nutrition and pathways and stuff with that, with functional medicine. And then from the exercise standpoint, a lot of, again, with the exercise physiology, when we're creating workout programs and we're trying to rehab people, like knowing in the most appropriate manner. So, I mean, that kind of lines up with the physical therapy, you know, aspect of it as well, but they do a great job. I feel like you can't go wrong with anyone. I love the exercise program and I wish it was a major when I was there. Otherwise it for sure would have been my major other than biology.
Yeah, I'd say in my field, ex-phys obviously, but and I wouldn't say I use it a lot, but I was a nutrition major as an undergrad, and I think that you know, kind of comes up from time to time, just as far as you know, some of the basic principles and just being more familiar with that can be helpful. Not that I'm using it on a constant basis, but just having that foundational background I think is helpful. And I don't know, there wasn't a class that I took at St. John's, and I don't know how picky they are, but I do a lot with EKGs, and I know that's probably more of a nursing concept, but if you ever have the ability, if you're interested in the field, you know, at least taking a basic EKG interpretation class is really helpful. And then just any, you know, other classes just related to, you know, exercise, or, you know, kind of understanding how to build an exercise program. Those are all just really helpful as far as, again, using your critical thinking when you're dealing with those patients that might be more lower level, so you're not starting them off on something that's, you know, too difficult or whatever. So
I would say all classes with labs, different perspectives and different techniques that you learn in different biology labs or chemistry labs or the ESSS labs. All of them have been helpful in critical thinking and techniques. So.
Awesome. Well, I think we are just about out of time. So I just want to thank you all for joining us. Maybe we can get some virtual claps in the room. And then, yeah, maybe you can get contact information for students who may have questions. If some questions come up, you can get their contact information and you can reach out via email. So thank you all again so much. We appreciate it.
Yeah.
Bye. Thank